is crippling herniated disc, eliminated without drugs or surgery. We do these every day to help you better understand outcomes. Our goal is to teach you so you can make better healthcare decisions. The more you know about your problem, the better decisions you can make. If the treatment doesn't match the problem, the results are not good. That's called outcome. The benefit of a treatment is called outcome. We have a solution when no others exist. We want to help you better make decisions. Patient-reported outcome data about specific treatments helps you. That's our goal. We want to educate you. This is all about giving you the tools. The tools we're going to give you are through the education. Why? Because doctors are not obligated to report the results of their treatments. The result of a treatment is what we call outcome. Because doctors don't have to report that, you have no idea what to expect when you get a treatment. Sometimes it's the doctor referred you, everybody expects you to get it better, but you don't get better because the treatment didn't match the outcome, the results, the diagnosis. Today's story, 48-year-old male, back pain and sciatica for 5 months. Okay, so didn't have it for a long time, but had it for 5 months. A lot of our patients have it for 7, 8, 9, 10 years. In this particular case, it was a relatively new problem, though everything over 3 months is considered a chronic problem. Okay, in this case, it was considered chronic, but still a new problem. And still in that point where trying to resolve the issue wasn't getting resolved with traditional therapies. So before the patient came to see us, patient had an MRI, had physical therapy, had seen their regular doctor, their medical doctor, had gone to an orthopedic surgeon, but also had gotten some injections. Now, typically the course of care for a back problem is physical therapy, some medicine, maybe chiropractic, maybe some massage, some injections, and then eventually what happens if all those don't work, you wind up in the office of the surgeon. Okay, we call that the ping pong ball effect, where nobody's really got control of your situation. You just kind of bounce around until one day you wind up in the office of the surgeon. Surgeon said you need surgery. Well, why did the patient need surgery? Because the pain was so high that the patient couldn't take it anymore, and the cortisone injections didn't work. Had 3 cortisone injections. Patient came in to see us. We have a 9-step sciatica solution, a 9-step solution to solve the problem. We've been doing this for 23 years. We've isolated it down to 9 exact steps. We precisely know what those steps are. One of the steps is to educate you, which is what we're doing right now. But also another step is to identify what is pinching the nerve. Sciatica is a pain that goes down the leg. It's a pinching of the nerve. We need to find out what's pinching the nerve. We have a very specific proprietary patented process. We have a patent on that process. We're going to identify what's pinching the nerve. Now here's what we identified. Herniated disc, bulging disc, stenosis, all causing the sciatica. 3 of the 5 reasons. There's 5 main reasons when sciatica doesn't go away. Patient had 3 of the 5. Patient had the herniated disc. Herniated disc is where the disc pushes into the spinal canal, pinching the nerve. Sciatica is a pinching of the nerve that goes down the leg. Right in here. Herniated disc, pinching that nerve. Also, patient had a bulging disc. A bulging disc is a lot like a flat tire, where the tire starts to run out of air and the outer wall of the tire pushes out. Okay? Same thing with the disc. The disc runs out of fluid, and as it runs out of fluid, the nucleus and the annulus start to push out, and that's what's happening with the patient. Bulging disc. Also having stenosis. Stenosis is a narrowing of the opening. It's a narrowing of the opening where the spinal canal is, but also a narrowing of the opening where the nerve comes off of the spinal cord through the foramen, right in this area right here. So I had 3 of the 5 reasons. When the patient came into our clinic, the patient had sciatica and back pain and leg pain that was a 10. Again, patient had it for 5 months. Not a long time, but when you have it a 10 every day, it's about all you can take. That's all you can tolerate. Patient had the injections. Did not get better. Had the physical therapy, didn't get better. Was taking pain medication, wasn't getting any better. Pain at a 10 is you've reached your limits. Can't take it anymore. That's why they wound up in the office of the surgeon, but didn't want the surgery. Came to see us. We have an alternative, an option that prevents you from having surgery. Okay, we have the ability to eliminate the need for surgery. Patient came in, Oswestry Disability Index is a 72. Oswestry Disability Index is a 10-question questionnaire. It identifies how disabled you are as a result of your back pain. Okay? It's scaled from 0 to 100. 0 is no pain, 100 is bed bound. Okay? Anywhere between 81 and 100 is you can't get out of bed. The pain is so bad you can't physically get out of bed. Now, this patient was pretty close. What we call crippling disability. Okay? That's pretty high. That's about as high as you can get without being stuck in bed. Okay? Typically, anybody 41 and above is a candidate for surgery. Okay, we have a lot of patients that avoid surgery, a lot of patients that are in this category that we're able to eliminate. Our goal is to get the patient back to a 20, back to minimal disability. Patient came in, was a 10, oswestry disability index was a 72, 40 treatments over 3.5 months, back pain was a 1, leg pain was a 1, oswestry disability index was a 2. What is outcome? How do you make better decisions? You make better decisions by knowing what a treatment can solve. What benefit does a certain type of treatment have for your condition? When you understand that, that's when you make better healthcare decisions. We talked about a study yesterday where they were able to eliminate 13,000 surgeries by giving the patients the best quality medical research about their problem. When you get the best quality medical research about your problem, you can get better. That's how you make better decisions. That is our goal. Our goal is to help you by giving you tools, and the tools come through in the form of education. Pain went from a 10 to a 1, so they improved by 9 points. That's dramatic. Oswestry disability index went from a 72 down to a 2, improved by 70. That's dramatic. Even surgery won't get you that far down. Surgery might get you 50% better, but very often 50% of all surgeries don't work. Okay? We have the ability to directly affect the disc. Our treatment directly affects the disc. We take pressure off the disc, we get healing in the disc, it frees up the nerve. Okay? We have proven that the discs can go away, and as they go away, it frees up that space. Our goal is to help you. If you find this helpful, we want you to subscribe to our YouTube page, but also we want you to follow us on Twitter. Our goal is to get as much information out as possible. If you have a problem that's not going away, we have a solution. You can call us, there'll be a link. You can click on the link to get the phone number, you can sign up for an appointment, or you can subscribe and you can follow, and you'll get the information you need. We're going to give you tips, we're going to give you exercises, we're going to give you some advice about certain foods that help bring down inflammation. Makes you feel better. Doesn't solve the hernia disc, but makes you feel a little bit better. That's our goal. Our goal is to lower the disability you have in your life as a result of your pain. That's it today. Thanks for following. Thanks for viewing. We'll see you later tonight.